Have you ever had a client ask you for the evidence behind a technique you are doing, or do they just care about how they feel after you perform the technique? In today's podcast, I talk about the three pillars of evidence: the research, the client's need, and the clinical expertise that we bring to the table. Listen in to see how we can merge all three for better outcomes with our clients. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. And today I want to talk about the three pillars to evidence-based care, evidence-informed practice. And if we look at the three aspects to working in this evidence-based care, we want to look at what the best available evidence from the research is. We want to bring that in. We want to look at the needs of our clients as the third prong, and then our second prong, and the third prong is our practitioner expertise. And so I get asked a lot, what is the evidence for this idea of the open birthing pattern? And when I first discovered it, I was trying to figure out what I was discovering in the body. And I was looking at the pelvic bones and feeling what was happening and the hardness. Thanks to Jerry Hesh, I had learned how to mobilize the different pelvic bones and to see what was moving and what wasn't moving. And then I just started comparing left side to right side and noticing that there was a big difference in that position of the ischium. Like the right side ischium actually is more common than the left side being out. And this right side ischium just not being, not moving in the same ability that the left side had. And then really taking a look at the sacrum and noticing that the sacrum is hard at S3 and 4, and what's going on here. And so I started looking at some books on labor and what needed to happen for a baby to be born. And I realized that the way that the pelvic outlet enlarges for a baby to come on out is really what I was finding in my postpartum clients. And later on, as I was doing the research to try to see what the research was saying about this, I did find studies that showed, yes, that the pelvic bones do change. They do widen in different positions to help encourage baby to come on through. And, there was one study that looked at the pelvic inlet and the mid pelvis, but they didn't look at the pelvic outlet at all. And their conclusion with 18 subjects was that the maternal pelvis was um, relatively stable. However, 11 of those 18 subjects ended up having a cesarean birth. So they didn't even come out the pelvic outlet. And so I just feel like you can't make the conclusion that they did when the larger majority of people never had a vaginal birth. So I did reach out to that author and asked to see if they still had their data, but it was 22 years ago and I haven't heard anything back. So I'm not holding my breath on that, but it sure would be amazing to take a look at what is the ischial tuberosity distance pre-birth and post-birth. What's the angle of the sacrum? What's the distance from tailbone to pubic bone? These are all things that I would love, love, love to be able to measure somehow, some way. So that's that first pillar of evidence-informed care, evidence-based care. And then the other is really looking at the needs and preferences of our clients. And our clients' bodies know best, and it's really up to us to learn how to listen to the body and learn how to assess it, to see what it has to say. And that's how I discovered this idea of an open birthing pattern, is really palpating and using the spring testing that I learned from Jerry Hesh. His approach to the pelvis is just phenomenal. and that we joint mobilize every other joint in the body, but we don't bring that same mobilization techniques to the pelvis. We're looking more for motion with the standing stork tests, and really when you mobilize the sacrum in the sacroiliac joint, you mobilize the ilium on the sacrum. That truly gives you a much better understanding of what's happening in that joint. And I believe he's now shifted his focus on the micro movements of the pelvis, and that it's really the end range micro movement of the pelvic bone that can get in dysfunction and cause the problems and the pain that a lot of people have in the sacroiliac joint. And so learning to listen to our patients is the third pillar. And then the fourth pillar is our practitioner expertise. And that is bringing this knowledge base that we have. We have an understanding that the ilium and the ilium go into anterior and posterior rotation. We know that the ilium go into inflare and outflare positions, and that they can get stuck in an upslip position. Jerry's gone on to identify, I think he said 18 other patterns in the pelvis. And the pattern I'm so focused on is this idea of an open birthing pattern, and the sacrum being stuck in flexion and the ischial tuberosities being splayed into abduction or just splayed out to the side laterally. And that's what, the books say needs to happen for a baby to be born. And guess what? It can remain. It can remain for years and years and years and years after birth. And so is what I'm teaching in my courses evidence-based? Yes, it is based on the evidence of the thousands of clients that I have worked on and I have treated. And now that my students are learning this work, they're also getting the same results and the same benefit to their clients by getting them out of pain, getting their pelvic floor muscles functioning better, all of this happening by returning their bones to their original position. Or maybe we're not, I have to, in my mind's eye, it feels like there should be a significant change in the number of the distance between the ischial tuberosities, because I can take a pelvis that feels like the ischial tuberosities are from the tips of my fingers to the edge of my palm, and I have very large hands. And by the time I'm done, my hand is cupped in half. And so I feel like I'm bringing those ischial tuberosities almost, half the distance, or it's decreasing it significantly. However, it could be that we're just imparting more of that micro movement that Jerry Hesch is talking about in the pelvis and allowing the bones to come back together. And boy, would I love to find a way to most effectively assess and research this idea that the pelvis does stay stuck in an open birthing pattern after birth. And so I am currently working with two researchers from A.T. Stills University in Phoenix, Arizona. And Pam and Rachel are amazing. We are working together to prove, number one, originally I wanted to prove that the treatment worked. Well, we can't do that until we prove that this open birthing pattern is actually a thing. And what we want to do is focus in on our pregnant clients and take measurements during pregnancy, and then take it after birth and see if we can prove that there is a significant change in the bones alignment post-birth. I mean, what would really be cool is if we could follow someone during their pregnancy and, in the first trimester, second and third trimester, get measurements of their pelvis to see if there's any changes, and then take a look at it postpartum, and see if we can prove that, yes, the bones are affected. Yes, they are wider. And we don't have thousands of dollars to throw at this. So radiologic imaging, which would be the gold standard for this, is not an option at this point in time. What we want to do is just hopefully create curiosity and intrigue for someone to take it to the next level and to do that radiologic imaging. And at first, we want to do it with just the tools that we have in the clinic. So right now we're looking at using a tape measure to just measure the centimeters between inside ischial tuberosity to inside ischial tuberosity and see if there's a difference there. We have tried doing some goniometric measurements using the sacral spinous processes as the leg of one goniometer, and then the angle to the inside of the ischial tuberosity with the other leg, and looking at that angle. And we are noticing a 2 to 3, sometimes 5-degree difference when we do that side to side. There's, again, no standard with that, and there's no standard with just using measurements either. So really, if you guys have any ideas, I would love to hear from you on ways that we can objectively measure what the bones of the pelvis are doing. And I'd also love to do sacroflexion as well. We do have a bubble inclinometer, and we're trying to see if we can get any distinction or difference from the angle of the sacrum during pregnancy and then postpartum, and trying to find neutral pelvis and then do a measurement and then hopefully afterwards find it and do it again. So those are things that we're thinking about. I'm just not sure that our measurements are going to be significant enough to show that there's a definite difference. And again, radiologic measures would be the ideal. And so if you have any suggestions, any ideas for me, please reach out. I'd love to hear from you. And if you are interested in learning more about how to make effective changes in the pelvis, please make sure you check out my Treating the Postpartum Pelvis course. It's a little over 3 hours of content, and you'll learn 4 of the pelvic patterns I addressed in this course. I don't talk about symphysis pubis dysfunction. That is covered in my holistic treatment of the postpartum body course. But I do talk about sacroflexion, posterior sacrum, the common birth pattern, and the ischium-ilium splay. And we had a really great response from our first cohort that happened last year. And I'm excited to be offering our second cohort that is starting in August. So please check that out if that is of interest to you. We would love to have you join us to learn that content. The cohort is a supported group of people going through the online course all at the same time. And you get email support, and you also get some online calls at the start of this course and at the end. And you can ask questions. You can I'd love to talk to you about any cases that you're currently working on and how to best implement this work into your practice. So please think about joining us for the Treating the Postpartum Pelvis cohort that will be starting soon. So check out my website to learn more. We've got link in the show notes so that you can join us. All right. So please join us in the cohort. Reach out to me if you have any information to offer for this idea of the research project that we're working on. And we just want to help support moms more fully and get them feeling better in their bodies after birth. And this research is all a part of making that happen. So thank you, everybody, for listening in. And we'll see you on the next episode. Here is to smoother births and faster recoveries. Take care, everybody. Bye-bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.